I'm Cynthia Moorhead from the University of Hartford. I will be presenting Theorist's Marilyn Parker and Charlotte Berry's community nursing practice model. By the end of this presentation, you will be introduced to Theorists Parker and Berry, be able to explain the Theorist nursing theory and the theoretical framework, describe key assumptions, propositions, and concepts of the theory, explain the nursing paradigm of the theory, explain pros and cons of the theory and its application in nursing practice, and review my interpretation of the theory through a case study. This presentation aims to provide nurses with an overview of the community nursing practice model, authored by Marilyn Parker and Charlotte Berry, and to explore and evaluate how the model can be applied to clinical practice. Parker received her PhD from Kansas State University in Manhattan, Kansas in 1982. She is a professor emerita at the Christine E. Lynn College of Nursing at Florida Atlantic University. She also developed school-based wellness centers to provide health and social services for children and families from underserved multicultural communities. Parker received the 2001 Fulbright Scholarship Award to Thailand as a result of her active participation in nursing education and healthcare in several countries. She was named a National Public Health Leadership Institute Fellow for her commitment to caring for underserved populations and to health equity. With her colleagues, she received a patent for a nursing language system for the development of electronic healthcare records that elaborate fully nurses' contributions to caring and well-being. Berry received her PhD in nursing from the University of Miami, Florida in 1999. Berry is also a professor at the Christine E. Lynn College of Nursing at Florida Atlantic University. With her focus on caring for persons in schools and communities, she also helped develop school-based wellness centers to provide health and social services for children and families in Uganda and Haiti. Berry was recognized in 2013 as one of the best 25 nursing professors in Florida. She's a fellow in the American Academy of Nursing, and Dr. Berry provides leadership in many community and professional organizations. The community practice model was developed over 25 years ago to blend the ideal and the practical. The ideal was the commitment to develop and use nursing concepts to guide nursing practice, education, and research. The practical was the effort to bring the theory-based practice model to life within the context and structures of an existing community healthcare system. The community practice model's mission relies on nursing is nurturing the wholeness of persons and environments in caring, and ensuring healthy lives and promoting the well-being for all at all ages. The assumptions of the Community Nursing Practice Model, or CNP model as I'll address it for this presentation, is that nursing practice is guided by three essential values that form the foundation of the CNP model. These are always present in nursing situations. The CNP model is based on the caring constructs and values of nursing, such as nurturing the wholeness of others through caring. Caring is understood as the essence of nursing, and respect for persons and community as a safe place. And this includes honoring the dignity of each person and understanding how each person defines health and well-being. Other constructs that guide practice in this model is the actualizing values, which present in some certain situations, meaning the nurse doesn't know all in a nursing situation and sees the person as an expert knower. These values are based on the principles of primary health care from the World Health Organization and include providing access to health care that is competent, culturally acceptable, cost-effective. So providing access to essential services, what is necessary for the well-being according to the client's perception. Empowering self-care, the client making own decisions for the health and well-being. Engaging in community participation and intersectoral collaboration to honor everyone's expertise and collaborate with others in the community. The purpose of the CNP model is to improve nursing education and enhance the care given to all and implementing community healthcare systems. Concepts of nursing practice that have emerged include transitional care and enhancing care. The CNP model supports values-based practice within the structure of interconnecting services and activities, which I'll be going more into detail, and community partnerships. The nurse uses these four concepts to guide observations, reflections, decisions, and actions in the practice setting. These illuminate the shared values embedded in the CNP model. Respect for person, which includes a stance of humility that the nurse doesn't know all about a person and a situation. Persons are empowered by understanding choices and defines what is necessary for well-being. Nursing nurtures the wholeness of the person and environment through caring. Nursing is dynamic and portable. There is no predetermined nursing or place. Nursing is also described within the context of transitional care, which can be challenging due to immigration status, confounding healthcare issues, and/or issues of the family. Enhancing care describes nursing that is intended for persons and families who need care in addition to that provided by the local healthcare provider. The environment within the CNP model provided context for understanding the wholeness of interconnected lives. The environment is not only the immediate effects described by Nightingale, but also indicates the social settings that contribute to health and illness, such as social determinants of health. Community includes self-defined groups who share common interests and concerns, who interact with one another. The CNP model considers all the elements of a person's life that influence health and well-being in the services and activities provided. Within the CNP model, the nurse creates care, plans services, and activities based on the theory structure. The structure of services and activities are depicted within three concentric circles of empathetic concern around a core. The nursing situation is the core, and services they may include providing access to essential care, assessments, referrals, health promotion, care navigation, home visits, and enrollment in health insurance programs. Services in the first circle may include consultations and collaborations with parents, administrative personnel, and appraisal and evaluation of programs that enhance well-being. The second circle includes a wider circle of empathetic concern that may include community resources with expertise in a particular discipline. The third circle includes local, regional, national organizations that provide structure, policy, resource, and consultation that support and influence the well-being of individuals and communities. The nurse uses assessments and evaluation of the patient to incorporate other resources and programs from any of these seamless interconnecting circles to ensure planning that centers the patient. The strengths of this model is that it's holistic and that it involves all areas of people's lives. Nurses are able to address patients' major issues and concerns and addresses social determinants of health, which is significant in our practice. Nursing care takes on an interdisciplinary approach, integrating collaboration with others, also something we do regularly. The model can be used in many settings, including for research and education, and the nurse provides the design and coordination of care. There are some limitations to the use of this approach in practice. First, the model requires research and it takes time, especially in the context of the third circle of policy change. Nurses already have their assigned nursing duties and they're understaffed. The model should include guidance for how nurses can utilize with their busy workload. The CNP model uses the inquiry group method as a tool to collect information to identify health needs and services and resolve problems. The inquiry method is a teaching and learning method that emphasizes knowledge related to how knowledge is acquired and not about knowledge. So for example, first thing would be asking an open-ended question and then listening to the person's perception of health and well-being, and finally recognizing and responding. My client is a 16-year-old pregnant person receiving prenatal care at a high-risk clinic for an underlying hypercoagulability condition and had no health care insurance, but was eligible for charity care. The client also reported hospitalization due to depression when she found out she was expecting. The client reported she was very concerned about properly preparing for her child due to a lack of finances. The client was living in a single-income household with a supportive family, sharing a bedroom with her mother and younger sister, and an older brother who had the attic space. The father of the baby, also a minor, was living out of state and not assisting in meeting the client's financial needs. Despite verbalizing educational goals, she refused to be in school while pregnant, as her goal was to have a healthy pregnancy. The client's first language is Portuguese, studied Spanish, but not fluent in Spanish and not at all fluent in English. At our first home visit, I asked the client how I could help her. The client asked if I could help her call the clinic to ask for a refill. I did, and I found out she had missed medical appointments and had not filled her prescription for an antibiotic to treat an infection, plus her Coumadin. The client expressed that she had difficulty getting her medications due to a lack of finances and health insurance, and she also reported that she had trouble scheduling appointments and keeping them due to the lack of transportation. The client was not communicating effectively with her providers, probably due to the language barrier. The client delivered a healthy baby and initiated breastfeeding. At our first postpartum home visit, a nursing assessment was completed, and the client reported chest pain and shortness of breath. I told her she had to go to the ER. She did not want to go at first. She wanted to wait until her mother came home from work that evening. She wanted to schedule an appointment with her doctor instead. There was no one home to leave the baby with. Her little sister was home, and we needed to plan for her as well. The client called her mother to tell her what was happening. Her mother did not appear to understand the gravity of what I was saying, which was that she needed immediate medical care. I spoke with her and asked her what she could do to make this happen. She made a few phone calls, and her little sister walked to her aunt's house, which she had done before. The client's mother would continue to work and then meet us at the hospital. The client's brother was home and accompanied the client and baby to the ER. The client was diagnosed with pulmonary thrombosis and multiple blood clots. I stayed with the client until the mother got to the ER that evening. During the hospital stay, I collaborated with her team to strategize on the best possible care after discharge. I connected the client to Uber Health to provide transportation to her medical appointments. The hospital referred her to DCPMP in order for her to receive the support she needed. She was discharged on a Friday. The next day, the client began to have chest pain and returned to the hospital on her own. I was very proud of my client for learning from her previous experience. We continue to support the client and her family in managing her health and being a new parent and working towards reaching her goals. This is my interpretation of the theory in my clinical practice based on the case study. The nursing situation is the core and provided the focus for care. Caring and being present, listening to her concerns of not being able to receive the care she needed. Evident in the first circle was the consultation with the client's mother as to the situation, the immediate care needs of the client, and the plan for care of the younger sister. Examples of connections to the second circle and influences on the nursing situation include the healthcare providers at the hospital and clinic, and the hematologist. In this nursing situation, in the third circle, the national resource, Uber Health, was prominent, but this also raises the question of policy changes and also how to provide access to services for immigrants. Some key points to remember is that the community nursing practice model provides services and activities that are grounded in nurturing wholeness by focusing on the well-being of persons and environment, guided by the values of respect, caring, and wholeness of persons. The nurse approaches with humility and perceives the person, not the illness, in order to integrate multiple ways of knowing to practice the discipline of nursing. And based on the CNP model, listening to client stories of health and well-being is an important core service provided by nurses and is essential in providing the design and coordination of individualized patient care and care delivery models.